Hi everybody, my name is Wanga Neswiswi. I am a final year student studying at Northwest University Val Triangle campus. So today I found it fit to speak about this chronic illness called endometriosis. So many of you must think, what is endometriosis? Well, endometriosis can be a lot of things, but it's something that is misunderstood. It is an illness that many people do not know about, especially girls. So today I saw it fit to take this challenge, to take this video to raise awareness of endometriosis. The reason being behind it is that I am an endometriosis warrior. I'm still fighting it, so it's more personal and I can more relate to the topic, and I can spread awareness to those who don't know what endometriosis is. And also this video is to show what ovarian cyst is, how to live with the pain of endometriosis, how to cope with the difficulties of endometriosis. So wherever you are, whatever that you're doing, make sure that you take notes of everything that I say. So I am a third year student, studying industrial psychology with labor relations. So I'm going to start off by naming what endometriosis is. Well, so endometriosis is a disease in which tissue similar to the lining of the uterus grows in other places in the body outside the womb. I know the word and the term endometriosis sounds very hectic. It is as hectic as it sounds, but it is treatable. So as you can see in this slide, there is a typical, I wanted to draw it, but that would be a mission. But there is a typical picture of the female reproductive system, and this is how, ladies, you can relate. So this is actually what we look like inside, right? So this is your ovary, this is, the fallopian tube. So the definition says that it is a tissue similar to the lining of the uterus that grows in other places in the body outside the womb, right? So this is your ovary, and it's supposed to look like this, right? It's a normal shape ovary. And then you get your endometriosis, which is these little things. So it grows on whichever organ outside the womb. It can grow in your tubes, it can grow in your ovaries, it grows everywhere. I will briefly, as the video proceeds, tell you about my story and my experience with endometriosis. So that is where this particular example is. So the endometriosis is inside the ovaries, as you can see. So this is the uterus and this is the endometrium. Some girls, however, this line, or this endometrium wall, like a friend of mine from Boch has endometriosis, and this part of her, this wall has thickened, so that causes great pain. So there are various symptoms to endometriosis that I'm going to read to you that is quite hectic, but it happens. So if you have any of these symptoms, I suggest you consult a gynecologist that will help you with everything that needs to be done regarding your symptoms. So the symptoms are pelvic pain, but sometimes it turns to chronic pelvic pain. There's bloating, there's fullness and heaviness, there's irregular period pains, and this is something that most girls ignore. Irregular period pains are not normal, girls. There's nothing normal about irregular. Even the word says it itself. Irregular period pains are not regular. It's something that should not be ignored, because it later on produces something that is not good, and you're actually damaging your sensitive parts, which are down there. Your back pains, but it is more of not around here, but it's lower back pains. And then you get your IBS. IBS is irregular bowel syndrome. So you can't do number 2. Like you can't take out what you eat properly because of the pains that are around your waist. And then there's a lot of nausea, like you're nauseous all the time. A lot of people, you tell, oh, I'm very nauseous, and people would just assume that you're pregnant. No, the nausea is caused by the pain. The pain is so much that you always feel like throwing up. So it's really, really bad. And like you get these cramps. They are very, 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 very bad. So that was the definition of endometriosis. Now we move on to something that's kind of similar, and that is where I basically started personally, and this is like your ovarian cyst. Now, there are normal ovarian cysts and there are irregular ovarian cysts. So an ovarian cyst is a sac filled with fluid that forms on an inside of an ovary or around the ovary. Basically, an ovarian cyst is growth, right? So any type of growth is painful. We all know this, girls. Any type of growth, cysts are found anyway, but now I'm just particularly talking about the cysts that are on your ovaries. So basically, their symptoms are similar to the symptoms of endometriosis. You do get your pelvic pain, which turns to chronic pelvic pain, which means that you are forever in pain. I would like to describe this pain as you are human, right? Your body is this, right? But then it feels like a thorn is constantly pricking you every single time. So this sickness is more internal than external. People don't see it. They don't really see it. You can say you're sick, but nobody believes you because they don't see it. But the pain is felt inside and the pain cannot be seen. So unfortunately, those who are suffering from endometriosis or ovarian cysts are most likely misunderstood all the time. And I can relate to that because I would tell people, yo, I am sick, but nobody would actually believe me up until I would be hospitalized. So I want to show you a typical picture like this, but this time it's going to be showing the ovarian cyst. Yay. So this is another picture of basically our reproductive system as girls. So basically your ovaries are on both sides, right? The things that carry your eggs, for those who are not aware what an ovarian is. Ovary is. So this is how an ovary should look in its normal state. But when, however, you get a growth on your ovarian cyst, then it becomes big like this. And you find when you get to the gynecologist and they tell you that, or they diagnose you rather with ovarian cyst, you find that it starts off as small, very, very, very tiny, but then it grows big. The bigger it grows, the more the pain increases. And I can personally testify to this. This is very, very painful. It is not like your normal period pains where you can just take any painkillers and take a hot water bottle and the pain leaves you. You need proper pills to really, really take this pain away. So with ovarian cysts, it is similar to your endometriosis. So before I talk about my personal story and before I inspire everybody around that is going through what I'm going through, or rather what I went through, then I want to talk about the treatment plan. Don't know if you guys can see this, but I will say there's a treatment plan for your endometriosis or for your ovarian cyst. So firstly, for you to be able to spot that you might have endometriosis or that you might have ovarian cyst, you need to go through the symptoms that I spoke about, right? So the symptoms of pelvic pain, your lower back, your bloating, your back pains, your IBS, all of those symptoms I feel have to be consistent. It's not like something you get once in a while or once in a month when you go on your period. When you go on your period, yes, I can say it becomes too much to handle, but these should be symptoms that you go through on a regular, so they should be persistent for you to be able to contact your GP, so your GP can transfer you to your gynecologist. So when you get to the gynecologist, they should be able to tell you So it is a medical diagnosis that you have ovarian cysts or that you have endometriosis. So depending on what your sonar scans show, they will verify what you have exactly. But the treatment plan is something that has to be done. So I urge every girl with irregular period pains or bloating or any of the symptoms that I mentioned to really seek help, because if these symptoms are ignored, then it should develop something that is even more above endometriosis or above what I'm going to talk about. So the first thing is that the treatment plan, the basic treatment plan that your gynae should tell you about is your oral birth controls. I know many people judge other girls for taking contraceptives, but you shouldn't care about that because you know why you're on birth control. I remember when I started my birth control, I was still in high school, and everybody who knew I was on birth control was just judging me. Oh my gosh, she's on birth control or whatever. But you know, because I knew my pain, and because I knew that contraceptives or birth controls were the only pills that could help my condition, then I had to just, I'd stand up for myself and take my pills with pride. It was difficult, but yes, you get the hang of it. So the basic ones and the basic treatment for endometriosis or ovarian cyst is your oral birth control or your contraceptives. Okay, so personally I take a brand called Yasmin's. I'm not saying every girl should take that brand, but my gynecologist suggested that I should take Yasmin's. They're very strong, so when you start taking them, they can cause a lot of drowsiness, a lot of nausea. The side effects when you first take them it's very bad, but your body adjusts to you taking them on a regular basis. So basically what contraceptives help with is to regulate your endometriosis, you regulate the pain. So many doctors prescribe contraceptives for many other things. Others it can be skin, others it can be prevention from getting a baby, and others for most of us, okay, for me it's just to decrease your growth, because with the ovarian cyst I will later on explain why I'm saying this. So your Yasmin, it is a Schedule 3, hence it's very powerful. So, but if you're already on contraceptives, then don't take mine. But for those who have the symptoms I mentioned, can try out your Yasmin brand for a starter. And then the aim, like I said here, is to prevent you from being on your period, right? So I know with those, unfortunately, I don't have a pack of contraceptives with me right now, but for girls, you know how contraceptives look. I think it's 28 pills if I'm not mistaken, but from my knowledge about studying my condition is that you need, in the contraceptive pack, there is proactive pills and there's inactive pills. So active and inactive pills. Your active pills are the pills that have a different color, like they probably are white. Now, these pills are probably white, so you take all of these pills at the same time, girls, same time. You take the pill every single day, and then when you get to the pill, the inactive pill, which is the pills that release the blood, you do not take that pill at all, because the aim of regulating endometriosis, or rather your ovarian cyst, is for you to just take your active pills, meaning that you do not want to be on your period, because when you are on your period, you are allowing the pain to be more than it is, and we are trying for you not to be in pain. So period pains and periods should just be a no-go area for you if you have this condition, or if you suspect rather you have the condition. So the pills or whatever the treatment that you're on should not bring any period pains. Like any period is just prohibited right now. So the other strong and recommended, highly recommended medication rather for your endometriosis or for your ovarian cyst is two things which are very extreme but needs to be done if, however, your endometriosis is very bad and it is at a stage where it is too painful for you to bear. So the first one, and a friend of mine is on this, and I'm gonna be on it soon, is your Mirena. Your Mirena is one that completely is medication that completely stops your periods, like completely. So basically they're trying to regulate your condition so the period stops, that you just stop going on your period. And then the side effects are really a lot, but once your body gets used to it, then it becomes fine. And then you get one that is very powerful, which is your Zoladex. Excuse me if I can't pronounce the medical terms, but I'll make sure the video has every type of pills that and medication that I have mentioned. So your Zoladex is a very, very powerful medication for endometriosis because its side effects are those similar to menopause. So yes, it stops your period and stuff, but the side effects are very, you take it for 2 months, if I'm not mistaken. You take it for 2 months and then you change to something else. And then you can't take, and for those people who are pregnant, you can't take the Zoladex because it actually, yeah, you can't. Yeah, you can't take also the Zoladex if you're going to have surgery, because another way of you managing or regulating your endometriosis is through surgery, and I'm going to explain that later. So if you know that your gynecologist has said that no, you're going to have surgery in the next 3 weeks, you know that you do not opt for your Zoladex, you only stick to your Mirena and your birth control. But if your birth control is not helping, you tell your gynecologist, the birth control is not helping. Because I know with me, when I had this, I'm going to explain later, when I had this, the pills that they gave me when I first began was not helping my body. The things that the gynae was saying was not the things that were my body was saying, excuse me. My body was not doing those things. So it was very difficult. So they had to up my dosage so that the growth is stabilized and it remains low, because it was growing way too quickly. My hormones was just acting up and it was just a mess. But that is why I prescribed the Yasmin's Schedule 3. I'll put them down below in the description box. But the Yasmin's are very, very good, personally speaking. And then the second type of treatment plan is your surgery. Now, a lot of people don't like hearing this because, yeah, surgery, you die in jail. They give you anesthetic, and some people believe they're not going to wake up. But it has to be done. If the damage is done down here, it has to be done. You have to go through surgery if you have to. Or sometimes, like in my case, my hormones were acting up. So this was just too much. Like it was just like a lot, and they had to like remove the growth. So there are 2 types of surgical treatments that you go through when you have ovarian cysts and when you have endometriosis. The first one, excuse me if I can't pronounce the medical term properly. So the first one is the laparoscopic surgery, and then you have the electrosurgery. So the laparoscopic surgery is surgery that uses a video camera and thin tubes inserted into small cuts on the body to repair or to remove the tissue. So wherever your endometriosis is growing and wherever your cyst is growing, in this case we are talking ovarian, so it's basically in your ovaries. I don't know if you can see, but it's basically here, right? So what they do is that they insert a camera in your belly button. Yeah, it's belly button, right? Yeah, they insert a camera in your belly button, and then they make 2 other holes here on your side. I don't know if you can see me, so I'm just gonna do this. So basically here, these are your ovaries, right? So I don't know, but yeah, that happens. It's painful, but not too painful, because you don't feel it. You only feel it when you wake up and you move around and you can see you can't really, they cut you, so you can't really do much. But that is something I've done too many times. And then there's the electrosurgery. They use electric current to cut tissue and to control bleeding during surgery. I have not done this. It sounds very painful, but if you have done it, you're so brave. I have not done that one, but yeah. So I do have cuts on my belly button. I have a cut where the camera went, and I have other cuts like on the side. It shows that I had a few surgeries before, and it was in removing that. So I want to talk about something else now. Pain control. This is very very crucial, ladies. Please take note that your pain control must be one that your body can sustain. You can't take pain control that when you get to campus or wherever you're going, you're going to be fainting on people. No, you need to test them out and see if my body can take a certain schedule, because they're different schedules, right? The higher the schedule, the lesser the pain, right? So if you take a low schedule, you start with the low schedule, like around schedule, I think Bernard is schedule 0 or 2, I'm not sure, but you start off, I would recommend you start with a schedule 2 type of painkiller and see if the pain does go away. But if it doesn't, then you just have to move to 3, 4, and then 5 is just extreme. Like if you're really suffering from this pain, and if this pain is too much for you, then you can go to your schedule 5. But that is only prescribed if they can see that, wow, you are suffering, then they prescribe schedule 5. So with the pain control, anything with ibuprofen is good. Anything. So if you're going to buy any painkillers, you need to check at the back. If it has something says ibuprofen, you take it, because anything with ibuprofen, okay, my friend said 400. So I have a friend that is studying medicine at Wits, and I only met him this year, but 4 years later, my condition, unfortunately. But ever since I met him, and the things that he tells me to buy, and the things he tells me or advises me to look out for when I buy painkillers have helped me, and this is why I look fine, even if I'm not, but I'm fine. Yeah, so big ups to him, Mohale from Wits. He is a doctor in the making, and he's also a gynecologist. So big ups to him for helping me with my condition. So I started off with pills called Maybelline, however you can pronounce it. I don't know if you can see, but they are schedule 2, so they cause drowsiness because they have a bit of codeine in them. But I feel like that's the only thing that they do. You don't take them before class, you don't take them before you go to church, you take them when you're about to sleep, and then it will knock you out, and then you'll sleep. You can get them at any pharmacy. I usually get them at Clicks. You get them there. They in a blue and white type of container-ish, but it's written Maybelline, it's schedule 2. So for those who are not sure what type of pills, because I get this question a lot of people ask me, Wanga, what type of pills do you use for your condition or for your period pains or whatnot, because mine are really bad. So I just tell them, start off with your Maybellines. They are very good, just that take note that it causes drowsiness, so don't take them before you study either, and then tell the lecturer that you are sick. No, just take them when you're about to sleep. It's more convenient like that. And then you see, like I wrote ibuprofen, so 400, you need to take ibuprofen, guys. It works magic. It just reminds you, don't do drugs, because wow, when you take anything with a high dosage of ibuprofen, you sleep forever. Like you just die, you sleep. You're not dead, but you sleep. Yeah. And then your still pains. I remember there was one incident where I was in so much pain, and then when I went to my hospital, Garden City in Joburg, my gynae prescribed still pains. They are schedule 5. I could not do anything. I could not go anywhere, because the minute you take them, you die. Like you sleep, it just knocks you off. But those ones are very good. But those ones are also, they also prescribed when you just had surgery as well. Because I think I had surgery that week, and my gynae prescribed them. They're still pains. They are green. They look like panados, but they are not panados. I don't know what they are, but they're very, very strong. So be careful. If a doctor prescribes anything with schedule 5 and above, just be careful. Make sure you're not driving or doing any funny thing. You just need to be in bed and relax. Yeah. So, and then you have the tramadol. The tramadol is very, very strong as well. Schedule 5 is the highest. And then the highest, I think it's morphine. Between tramadol and morphine, I'm not sure which one is much stronger, but my friend also prescribed tramadol for me. So tramadol is not to be taken if you're pregnant because it will kill the baby. It will harm the baby. Your baby might have defaults or something. So make sure if you want to go on tramadol and you tell your doctor that tramadol is what is needed, please, please, please make sure you are aware if you are pregnant or if you're not, because you're going to miscarry, you're going to lose the baby or something's going to happen with your baby. So make sure that you are not pregnant when you're on such strong pills, because the side effects are bad. So with the pills, with the tramadol and with the still pains, the ones with schedule 5 that I prescribe and the ones I take, I think most people understand why I'm always sleeping, but okay, sharp. But with the still pain and with the tramadol, it causes very, very, very bad side effects. So you need to, that's why I'm saying don't take it when you are going somewhere or driving, or when you are going to church, or when you're doing other funny things. Don't take it. Because also one of the side effects, it causes constipation. So there's something that I know, a friend of mine from Port Sabrina, because we have the same condition, we were on this thing where I forgot the name, but it helps with constipation. It's like you put it in water, it's like a powder, you put it in water and you drink it, and then you take out stools. Because remember, one of the side effects was IBS, which is irregular bowel syndrome. So you don't really take out things that you consume properly because of the excruciating pain, but rather this thing that is prescribed by your doctor is more of releasing what you consume, because everything will be stuck and you need to take it out. So this thing for chronic IBS is a sachet, rather type-ish, powderish thing, where you put it in water and you drink it. If I remember the name, I'll make sure that I somehow put it down by the description box. I'm not sure the name, but I know it helps you take out stools. So, okay. Another important thing is food consumption. I don't know if you can see, but food consumption is very important. I am still trying to change my diet. It is very, very painful, very, very uncomfortable to eat things that are not nice, because with all the pills that you're taking, with all the medication that you're taking, my gynae also once said that certain foods trigger pain. So sometimes you would be okay on campus and then you eat something, you're not aware what you're eating, but you are aware of what you're eating, but you don't know what food really caused the pain. I would be on campus and I would order something and I would eat, and then after 2 minutes I would start feeling a whole lot of pain, and which means now before I start fainting on people, I need to get back to my room and take my pills and sleep. This is why I'm never to be seen. Yeah. Anyway, so the food that you eat, like he wasn't a gynecologist, but my case got to some doctor at Garden City, and it was like a surgeon, and he told me that I need to eat a lot of foods that are high in fiber. So you get your all brand. I know it's very expensive type of food, it's not really affordable, like your fatty food, but then it helps a lot. I've tried it, and when I eat it, like I can go 2 weeks without feeling severe pain. So all brands, your wheat bix, it also makes your bowel movements relax a bit, and you're able to at least go to the toilet and whatnot. So your all brands, your wheat, anything, food with grain, like your porridge with grain, everything with grain is fine. Your fruits, your veggies. Just avoid alcohol, avoid fatty foods, replace it with fruits and veggies. You limit your caffeine. Like, I know coffee is very, very nice, but try your best to just limit. So another personal thing that I also want to share, always, I want to show you on the screen. I recommend a hot water bottle for any girl that has irregular period pains, who is suffering from endometriosis, and who is suffering from ovarian cysts. Like, always, a hot water bottle is needed. I know a lot of people have seen me with this on campus, but this is really, 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 I can't emphasize it more. Like, a hot water bottle, or rather get an electric blanket, but please be very careful on that one. I know I'm not careful, so hence I don't have it. I had it before, but then something happened. So you need to make sure that you have something. You are always warm in the sensitive parts, because you are trying not to cause more damage than damaged already exists. So you can't be ignoring. So you need to make sure that you have your hot water bottle with you all the time, so that you stay warm and your sensitive part stays warm. Avoid being cold. You need to dress up. This is why I avoid going out at night. You need to dress up. If you do decide to go out at night, dress warmly. Make sure that you can't be sleeping on the floor. But funny enough, I'm saying this, but sleeping on the floor actually helps me with my pains for some reason. So you need to make sure that you are warm and everything. So I just want to inspire anyone out there. If anyone is taking any notes, I just want to inspire you. Having this condition actually led me to 5 things, right? It taught me 5 things. It taught me courage, it taught me self-love, it taught me forgiveness, it taught me growth. So you need to understand that no one is going to understand how you feel, but you need to fight the pain with whatever you have. The pain does not define you. You are not the pain. So you fight it with everything that you have. And another thing that will help you with this whole condition, whoever I am talking to right now, whoever is listening, is support. You need as much support as you need. You need as much support. You need as much love from friends and family. This is how you get, because it's chronic, right? It's only treatable and manageable. It doesn't go completely unless God does a miracle, but it can lead to a whole lot of depression. So have people around you, interact with people, but don't expect anyone to feel your pain. It is okay to have endometriosis. You need to stand up for yourself and not expect anyone to feel sorry for you, but you know the pain. So I encourage everyone. I stand in the gap, and I stand and represent every woman out there who is going through hell because of endometriosis. It is okay. It doesn't define who you are. You need to believe in your dreams. This is more reason to get what you want. It is more reason to achieve all the goals that you want to achieve. So don't let people let you feel like the pain that you're feeling defines who you are. So whoever I have touched out there, please make sure that you consult your GP, your gynecologist, if you have consistent symptoms of what I just explained. And for more information, just empower yourself about endometriosis. It is something that is living, but many people don't have enough knowledge for it. But yes, I hope I inspired someone with my story. You can do it. You can achieve anything through the pain. It is okay. It is fine. Thank you.